Greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today it is my very, very great pleasure to welcome Yewande Ogunkuade from Australia. She's out of Australia. Yewande is a multi-registered nurse. She's got a Bachelor's of Science in Nursing, a Master's in Global Health, and she's currently residing, as I said, in Australia. She has a strong interest in public health and health policy and education. She says that she's committed to advancing health literacy and empowerment. Now, she's also the founder of an Afro-fusion clothing brand celebrating cultural heritage through contemporary fashion. And I'm going to let her tell you how to pronounce the name of that. But anyway, welcome, welcome, welcome,
Thank
Yewande.
you. Thank you so much. That
All
was,
right.
very concise and straight to the point introduction. But yeah.
That's the goal. Well, first of all, tell me, why are you a nurse? What brought you to nursing?
Oh, okay. So I think I'd say that my journey into nursing was very coincidental. So I'm Nigerian and I studied in Nigeria.
Mm-hmm.
And before you become get into the university at a point when I joined the university in Nigeria, you need to write this exam. And for the exam, you need to have two choices of the schools you want to go to and the course you wanted to study. At the point, I wanted to be a medical doctor. I really don't have a reason why I wanted to be a medical doctor. I just think it was just a force, like everyone's either a doctor or this or that. And
Mm-hmm.
so that was my first choice. For the second choice, I wasn't sure. And I chose nursing with the help of my mom. And I come from a family line of nurses. So my dad's elder sister is a nurse. My dad's twin sister is a nurse. And it felt like, oh, there are people who are doing this since this was just your second choice, why not just choose nursing?
Mm-hmm.
You probably have people to tell you about what nursing is. And so before I chose it, I asked my dad's siblings, whoever excited, obviously, to see a younger family member wanting to be a nurse. But
Mm-hmm.
at that time, it wasn't like I just did it because I just needed to choose a second choice. And
Mm-hmm.
so I did the exams, went for the pre-exam, and then I didn't get medicine, but then I got nursing.
Mm-hmm.
So, so with what we do with in the exams, after your first choice, if you don't get the cutoff mark for your first choice, you probably have to reapply or make a change. But for me, I didn't have to do all of those. I just got nursing.
Mm-hmm.
And so I just realized I had nursing. I just needed to make do with what I had and then decide if I wanted to still be a nurse or go on with the study or
Mm-hmm.
maybe the next year write the exam again. But in my
Mm-hmm.
first year of nursing, I think that was when I decided I really wanted to be a nurse. So I coincidentally got into the study, but my early weeks, I wasn't ready. I wasn't really wanting to be a nurse. In fact, I actually wrote another exam to want to go back to study medicine, but
Uh-huh.
I needed to write a post exam, and then deciding not to go for that post exam was when I actually decided that I think I wanted to be a nurse because everything I felt like I wanted to do as a doctor, not obviously the whole base
Yeah.
post clinical skills, but every other thing basic I could do as a nurse. And even with nursing, there's still that very much white space where you can explore more. And I was like,
Yes.
why do I want to go further? And so that's when I actually decided that yes, I'll stay and finish this study and be a nurse.
Exactly. So here's the thing. You had
Mhm.
family members who were nurses, so you had an example of,
Yeah.
nursing in a sense. And you went into this as a second choice. Maybe I'll do this. I didn't have anything else. What challenged you the most?
So are you saying challenge me to decide to keep being a nurse or challenge me when I already decided?
When you already decided to be a nurse and you became a
Mhm.
nurse, what were the challenges for you?
Okay, so the challenges for me as at that time was very much more external, environmental, societal based because, like I said, I
Mm,
studied in Nigeria, and the perception nurses have in Nigeria is not great. It's not the
mhm,
the best. Obviously,
mhm,
from what you see online, from what you watch on our movie industry, it wasn't
Mm-hmm.
just portraying nurses as what they were. So I got
Mm-hmm.
to understand nursing for me. Like I said, my dad's siblings were older. They had been
Yeah.
nurses like 30 years
Mm-hmm.
ago. So it's different from when I decided to be a nurse.
Exactly. Mm-hmm.
They just said, "Oh, nursing's a great career. You do well. You just have to." But they had their own generation of nursing. This is my
Yes.
generation. We had a different concept and idea, and we
Mm-hmm.
had people who want like stories of nursing. Nurses are like the assistant to doctors.
Yes.
You couldn't be what you wanted to be. You had to just be a nurse for a
Mm-hmm.
doctor, something like
Mm-hmm.
that. And I
Mm-hmm.
just realized that personally, I'm not someone who wants to be that. So I went into nursing with that mindset of what nurses are. But then
Mm-hmm.
in school, seeing my lecturers, also doing personal research, I realized that nursing is broader. It was just the perception of where I was. And I
Mm-hmm.
already knew that I wasn't going to be stuck here. I wanted to be more global. So
Mm-hmm.
I would be able to do what I wanted to do, even if I wasn't here. Even if I was here, I probably would also,
Yes.
but it
Yes.
probably would take a longer time. And of course, with the trajectory changing now, it's even way easier for people to do other things apart from. But then that was the main challenge, me accepting nursing for what it was and
Mm-hmm.
accepting that I can do what I wanted to do, irrespective of what the scenario was at the time. So yeah.
Yeah, yeah. And I have to tell you that what you just described is not unique to Nigeria at all. That is a very global perception of what nurses are and who we are. And that's one of the reasons that I do this because I really think that I would really like people to see nurses for who we are. And
Yeah.
for us as nurses to see just what the opportunities are in this very vast and very interesting and varied field. So. And so, having become a nurse, though, I see that you are multi. You started by saying that you are multi-licensed, and I see that you're licensed in Nigeria and Australia, New Zealand, and Great Britain. Um, what kind of areas have you worked?
Oh, so I think I've worked in various areas of nursing. Um, Starting off in Nigeria, I had to do a 1 year internship after my like post graduation, and the internship actually takes you through different units of the teaching hospital. So I did
Mm-hmm.
medical, surgical, and I'm also a midwife, by the way. So I had to do the obs and gynae
Yeah.
posting, secretary posting. So that 1 year was a year of me doing I think about 3 months in each of these units.
Yeah.
So I had that experience. But post my internship, I worked in a private hospital where in Nigeria, private hospitals, to be honest, are not very, very, very specialized. So you see yourself working in that hospital, but you're doing other things. So you're probably attending to deliveries and beds, you're attending to other things. So I was just more like a general nurse,
Mm-hmm.
doing things that I could do based on my own experience as well. But after then, during the COVID pandemic, I got the best job of my life where I had to work in emergency preparedness and rapid response. So that was where, the whole public health thing started for me.
Uh-huh.
So during that period, I worked in public health, emergency response, migration health, all of this were very much intertwined, but
Yes.
it was more of like all the aspects of public health. And then after that, I went to the UK where I worked in aged care, so geriatric nursing.
Mm-hmm.
And now I work as a rehabilitation nurse, um, who also just recently got an offer to get to work as a leave cover in the IPC unit of my hospital, which marries what I did as emergency preparedness, infection
Yeah.
control, and I have that opportunity to in work as a leave cover for that's in the whole hospital. In addition to me working as a rehabilitation nurse, so I think I've done quite a few. Maybe not the master
Uh-huh.
of all of them, of course, because it was just bits. But for the ones that I stayed longer and I had more interest in, I would say that I have gained that experience.
Yeah. Well, congratulations on your new funding position.
Thank
So
you.
here's what I have to ask you. Having worked in the several countries,
Mhm.
um, what do you find are the I don't know if obstacles are the word, but what is the biggest thing that you have to get used to as you change countries and cultures?
To be honest, it's also getting used to the cultures, the norms, the values, like the societal values of whichever country it is. But
Mhm.
with me, it's a bit different because for each country I moved to, I've gained more experience. I'm going in
Mhm.
there more experienced.
Mhm.
So it's
Mhm.
not like I'm just spending 2 months here and 2 months there. In Nigeria, very easy. I schooled there. I'm from there. I understand the
Mhm.
values. For every hospital I've worked is something different. For every unit I've worked something different. But the major goal is the
Yeah,
same.
it's the
So
same.
yes. So now moving to the UK, it was my first international job. Aside from the fact that I had worked for an international organization, but this was my
Mhm.
first, obviously, geographical international job.
Mhm.
But I moved in there with all of the knowledge I had gained working with the international community
Yeah.
in 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 Nigeria. So it wasn't so hard. I think what was just different was the fact that I was going to work in an aged care geriatric unit, which was different, and it was
Mm.
dementia. So
Mm.
you had to cope with people who probably hadn't seen someone as dark as I am, and they
Mm.
always obviously also have dementia. So at that point, their mental health is not even the great space, and then they're
Mm.
saying something different. So I had to cope with
Mhm.
not classifying everything I went through as racism, but as the
Mhm.
fact that this is what they're going through. They're not having the right mental stability. So of
Mm.
course, some things are not right. And then coming to Australia was quite different for me. I got the job before I came in here, obviously, and then I came in here as a permanent resident. So it meant that I wasn't scared about trying new things. I wasn't restricted with my visa. I wasn't like, just there because I want to just be here for me to get to this stage of my
Mhm.
migration status. So coming here, I came in here like a free bed.
Mhm.
I'm here to, explore. So I've been here for just a bit over a year,
Mhm.
and I just wanted to do that 1 year understanding the system in Australia. And I'm also just not just in Australia. I'm in the smallest state in Australia. I'm in Tasmania. It's like an island in the island. So you're
Yeah.
not we're we're not so we're many, of course, but not so much. It's not very urban. And
Mhm.
so you kind of like want to know what you're doing before you delve in. So I gave myself a year while I was working in my rehab ward to also
Mm.
understand what the system was. And to be honest, exactly a year after I came into the country, I went for this IPC training where I met with the IPC norm, and then I already knew that this is, a year after I'm ready now to do other things without the
Yeah.
restriction. There's no
Yeah.
restriction now. I'm open. It's more of me to say, what do I want to do? What do
Yeah.
I want to put my energy into? And so, yeah, different experiences. But I just would say I was gaining knowledge as it went. Not
Yeah.
easy moving countries, but what it is.
Well, you know what? That's never easy, but always very, for me, always very exciting.
It
Yeah.
is exciting. It is. And for
Yeah.
Australia, it's very far,
Mm.
very, very far. Obviously, a different healthcare system to what is in the UK.
Mm.
Um, with Nigeria, I think Nigeria is like a combination of both, depending on your
Yeah.
status,
Yes,
something like
that
that.
is. Yeah. Yeah.
Yeah, so
Yeah.
it's just so different, understanding and putting yourself out there to say, hey, I might be new here, but I have things to give. So yeah.
So speaking of having things to give, we talked about in your introduction, we talked about you said that you're committed to advancing, health and literacy. Public health is your thing. Sis. How big is this vision for you?
I would say it is very big. I'll put it as the spotlight of my nursing career because, like I said, you don't always see nurses who are happy who want to do these things
Hmm.
because there's a lot of restriction, not restriction, but there's just a lot of leverage on people staying in the clinical space, and then they're just there. Being there, you have no other knowledge of other things. And of course, with the clinical space, you have to be aware of what the social determinants are. You have to be aware of what policies are or, other health education policies. Things change, you have to be aware
Hmm.
of. health equities and inequalities, but just being focused on one aspect of nursing. For example, like I said, I'm a rehabilitation nurse. In rehabilitation nursing, you have other things. You have hand hygiene auditing, you have infection control, you have,
Yes.
wound care, skin care. But in the center of all of this is the community setting, the health equity and inequalities. Do we have the availability of things to help get these people where they are? Do you know
Mhm.
how to be an advocate for your patients? It's not just being in the clinical space.
Yeah.
If you have to talk, if you have to be in a family meeting or you have to be in like a multidisciplinary team meeting, can you say other things apart from what you just do in the ward?
Yes.
It's more of like
Yes.
this education to make nurses more broad, nurses bold, because they have the knowledge. They
Hmm.
wouldn't feel restricted to talk or be the advocate of their patient. You don't necessarily have to be out of the clinical space. Not every nurse would be a non-clinical nurse. Not everyone not
Exactly.
to be an academic nurse. But even with where you are, can you have that knowledge and idea to want to do this? So I haven't really started, but I am at a point because, like I said, I also am starting a cultural band, which I probably will talk about. But at the
Mhm.
point, I've obviously thought of how of building a community, maybe not a community, but just sharing information on social media platform because of course that's what people leverage and on now to learn.
Yeah.
So just talking about things I have experienced in my different roles, talking about things that I have thought of wanting for other people to know of. So basically, starting off with that literacy and education, building community of nurses who are not just what they think they are, but could be more with the
Hmm.
knowledge they gain. And yeah, that's just it.
So you are an entrepreneur. We
Mm.
said that you have this Afrofusion clothing brand. Tell me how to say this name.
So it's pronounced as Abefe.
Abefe. Okay.
Yeah.
Why Abefe?
Okay. So maybe I'll say into I'll give a concept or like,
Uh-huh.
it's just like a storyline. So when we moved to Australia, myself and my husband, um, we for very few times or random times rather, we had worn our cultural clothes, like probably to go to church or I think I've worn it for like an official meeting. And then
Hmm.
I got the stares, people looking at you like it felt like they were looking at me like, what is she wearing? Until
Hmm.
someone confidently came to me and was like, this is so beautiful. Where can I get it from? Obviously, I did the research on how because I wanted to just send her a link. I did the research. Here in Australia, there were actually a few, but here in Tassie, I couldn't find any. Like in Tasmania, I couldn't find
Hmm.
any. But it wasn't just more about that interaction of wanting to provide this. It was more of the fact that with this cloth I was wearing, someone else could walk up to me and have that conversation. So it was more of like cultural appreciation,
Hmm.
cultural cultural exploration, but in the major like in the limelight, more on cultural unity.
Yeah.
So looking at me, I wasn't seeing her having the conversation, and obviously I've had different other ones. Like I said, at work, my colleagues would just be like, "Oh my God, this is beautiful." But
Mm.
having thought about all of those situations and scenario, for me, it was more of like when people look at me as of now, I do not see it as being weird or
Mhm.
classify it as being racist, in that sense.
Yeah.
I see it as someone liking and loving what I'm wearing, building that unity. And
Yeah.
aside from being a nurse, or aside from just being an African here in Australia, even as a nurse, I realize how important it is for people to understand your culture. It makes you
Hmm.
bond well. For example, obviously, I'm the only one who has this kind of hair at work. But yeah, when I have to relate with patients who probably know Nigerians, there's just that subtle flow because they're not scared or they don't have to ask too many questions like what's your hair like? What do you have on
Yes.
your hair?
Yeah. Hmm.
Why
Hmm.
do you have this colorful earrings? Or why there's not that. So you don't have you've passed that barrier of would she get me? You've passed that
Yeah.
barrier. You're just going straight into the patient care you've come to give. And so that obviously would be in different other organizations. With
Yeah.
Australia also being a very multicultural state, there are obviously more people coming here with migrate with who are going to be migrants. So it's also me building that community of people who love culture, who appreciate culture. But in the center of it will be that my fashion brand, because that was what pushed me. That's what people saw and made me want to explore that. And also for the name, why Abefe? So Abefe is a Yoruba name and it means to be highly sought after or begged to
Hmm.
be loved. That's
Okay.
actually my husband's name, by the by the way. But but we, aside from the fact that it was his name, with the scenarios of what bettered this, people saw me and just loved me.
Mm.
People like I was kind of like being sought after. I felt like I was an African queen, and they're like, "Oh my God, this is beautiful," and all of those centered around what Brexit is
Interesting.
also in the meaning of Abefe, to
Hmm.
be sought after. So for us, anyone who wears this cultural piece, not only exploring cultural unity and diversity and inclusion, you're also exploring yourself with you feeling loved, people seeing you like, oh my God, this is beautiful.
Yeah.
It's like
Yes.
being the
Yes.
center of attraction. So everything in between, it's just, creating a better world with that.
Got it. Got it. Got it. So here is the question I have to ask you. Is there any particular skill that you developed as a nurse that you found very useful on your entrepreneurial journey?
Oh, so many, so many. I feel like nursing is an intersection of so many things. From assessments, because obviously, like I said, starting this business was more of like through a very random survey of
Hmm.
me being there and people. But obviously, that's what it is in nursing. You want to assess to know if you want to do this thing. You want to assess
Yes.
what to
Yeah.
do. So that
Yes.
was like, yes. And then obviously, I would want to say, I can't remember what nursing theorist did that thing, but it was like, it's the stages of the nursing care plan, assessing, diagnosing,
Yes.
planning. So I
Yes.
feel like I just use that stage with what I'm doing now. I'm still in a way in the assessment phase, but I'm more of like in the assessment, diagnosis, and planning stage where
Stage.
I'm still meeting up with like cultural enthusiasts and organizations here in Australia because this I just registered this business in January, but there's
Okay.
just this commitment. People are happy to want to do it. And so obviously while I'm assessing, I'm diagnosing what exactly should I do? Who should I focus on first? Should I
Yes.
focus on children? Should I focus on women first and create this collection first on these people and then I'll diversify. And all
Mm.
of this I'm obviously also planning because it will involve working with local artisans, it involves working on building a community here,
Mm.
obviously the launching process. But and then in the whole long run implement this building this community, starting up with my collection, starting up with reaching out to people
Yeah.
and all of that. But with nursing, having to do all of this with nursing, as a nurse, you see a patient first on physical assessment, first
Hmm.
on even when you have to go with like checking their ups and all of those things, it's more of assessment. And then with the assessment, you plan. Oh, hey, the SpO2 is down. What do we do? We need to
What
give
you do?
oxygen. Yes,
Hmm.
and you've planned it. While you're planning, you're already diagnosing this is hypoxia. This is this. This is
Hmm.
bradycardia, we need to do this. And then you're implementing based on what you've assessed, what you've planned to do, you're already implementing. So that's also the stage. I'm following those stages of nursing care plan. I think it works in everything you want to do. Whatever you're doing, you're just following that stage. And of course, by the time you've implemented it, you can always evaluate your outcome and then go back again. After
Yes.
evaluating, you
Yes.
go back again to reassess and be like, okay, this is what I did well. Let's go on. What are we changing? And we move on.
Hmm.
That's just what we do in healthcare, anyways. And it's
Exactly.
just been it.
Exactly. So I have a couple more questions. First of all, what
Yeah.
what what advice would you give to someone who wants to be a nurse?
Ooh. I would just say it's just good for you to know that nursing will challenge you. It's now up to you to face this challenge and give it your best To be honest, there
Mhm.
is no easy way with nursing. No matter where you are, there's no easy way with nursing. So nursing will challenge you, but how you face up this challenge is what is important. And
Mhm.
also for people to know that you don't have to be stuck in one unit. You don't have to be stuck in one sphere. Diversify. You can do different things. Like I said, I worked in the medical, surgical, everything unit until I got that job. So I don't think I said it, but the job was with the United Nations, and
Mm.
it was just the best. Not just the fact that it was a United Nations job, but because I was doing something very pivotal at that point. It was the COVID pandemic. Everyone was scared. I wasn't just only working as an emergency nurse, but I was working as someone who was working with an organization that would give you everything to make sure the best comes out. So
Mhm.
if I was scared to diversify, if I was scared to apply for that position, obviously the pandemic, but it
Mm.
wasn't just me being in the clinical space, it was me doing every other thing outside and in the clinical space. I was just a new grad, but I just thought, why not? Why not apply? Obviously, I went in scared. Luckily for me, I got the best supervisors and the team. I was the youngest in the team, but I was the youngest age-wise, professionally. But I went in scared, but I didn't put myself at the back and felt like, oh, I don't have 10 years experience. I don't think I can apply for this. So you need to be able to push yourself. Just do it. You obviously won't get everything. But if you don't try, no one would see you. If you don't try, no one would know you.
Nobody would
Um,
know.
no one, yeah. Like a lot of times I talk to people and I say things I have done, and they're like, oh, you don't post so much. I sit back and I'm like, truly, I'm not even doing as much as I should do. But it's a good thing if you have the insights. So when you're not doing it, you know it's your fault. But if you don't
Yes.
know what to do and you don't do it, at that point, it's not your fault, but ignorance is not going to change anything because there are a lot of people who are doing what you want to do.
Yeah.
And if there's an opportunity, those people will get it first.
Yeah.
There's no
Yeah.
two ways to it. There's no those people would obviously get it first because no organization is committing to putting their money into unnecessary trial. You
Yeah.
don't have to be
Yeah.
in that phase. You don't have to be in that organization. You don't have to be in that space. But the little things you can do in where you are would obviously always help when you get to the point where you
Yeah.
think you need it. So
Yeah.
try whatever you are, try whatever you can do, even if it's just reading, even if it's just talking to people, even if it's just writing a little note of or a little article on LinkedIn of what you've read, what you think, having that conversation, that community. I'm also talking to myself, by the way, because
Okay.
with nursing, it always goes, no matter what stage,
Yeah.
career or experience you have in nursing, you need to still be very open-minded and push and just diversify until you think you're in a stage where you love. It's not
Yeah.
just I'm there because I'm there. It's because I want to be here.
I want
I'm
to.
making impact. I love it. The whys have been answered, like all the whys you had before you went into the job. You've answered this job answers the questions, then yes, you can decide to stay. Even when you are in that job, there's always a higher position, there's always a higher role.
Hmm.
And for it's also good for you to understand that you cannot make the change from outside the room. Like you cannot just be somewhere random and make the change. You can think, oh no, I think I want nurses to be like this. But if there's no one in the forefront to make this change, it's just going to be there. Because
Yeah.
if they don't get to know the problem, even when they know the problem, if there's no someone to prefer it, a solution,
Hmm.
it's just
It's
there.
just, yeah. It's
So you're
just
just
another
in your
problem.
yeah, you're just in your little corner complaining. The people who probably are in the places to make the decision don't even know about this problem. Probably it's not their fault, they don't know. But you've experienced it, you know it. You can always go. You don't have to be in the top management position, but there could be someone in the management position looking for someone to have that conversation with. How would they see you? How would they know you when you're not out there? So yeah, it's a very long, long statement of advice, but There's
But it
always
is good. It is sound. It is sound. So you do so much. You've done so much.
hmm,
Um, what do you do to care for you?
hmm, self-care. What do I do to care for
Hmm.
me? I think I'll just put my self-care under the one word of me being aware, or maybe two words, awareness and presence. Or I'll think awareness is just the right word. Me being aware that aside from me being Yewande the RN, I am Yewande the person.
Hmm.
So I'm just aware of that. Whatever situation I am, I need to put me first. And
Hmm.
obviously, when you put you first, you give the best care. Because if you're
Hmm.
healthy, if you're more healthy, more emotionally and physically sound, because of course, nothing will drain you in both aspects. So
Hmm.
if you're emotionally, physically sound, you can give the best care to your patient. But if you're none of these, it will be hard. So for me, I don't. I work full time, by the way, at the moment, but it's a bit easier in Australia because we're on the 8 hours shift role.
Okay. Hmm.
So 8 hours is just okay. You have the whole day to yourself if you work the morning, and we have the like, three shifts, so you can actually work the afternoon. So you have
Yeah.
the whole morning. If you work the afternoon, you have that rest period. I obviously prioritize my rest.
Hmm.
Um, and then trying to do new things that I can based on what I have at the moment, what I have available. So at the point, I obviously joined the gym, just to free myself. Then sometime last year, I learned how to swim because I think that was better on the fact that I went for a vacation and everyone was swimming and I just couldn't. But then I
Hmm.
also realized that it was a life skill. You need to know how to something you
Hmm.
can. Yeah, so I learned
Hmm.
how to swim. And then I try to try go for a vacation as much as I can. Obviously, that's obviously more financially
Yeah.
dependent, but I try to go as much as I can. In February, I was in India for a friend's wedding. It's
Hmm.
just and all of these, obviously, aside from me resting and giving me that self-care, is also centered around everything I want to be. Like me traveling gives me the opportunity to explore other people's culture. So I can say I'm bringing in this culture into my business as
Hmm.
I said, you know, if I have to talk to an Indian person about cultural clothes, it's just so easy now for me to have that conversation because I just haven't read about it. I also experienced it.
Hmm.
So
Hmm.
all of this makes me more, emotionally calm, emotionally rested, and all of that. And then another thing I do for self-care that is more psychological and mental is me actually attending or going for conferences that I can. It sounds like a job, a work on its own, but for me it's peace. Because I feel like
Mm.
with conferences that I can attend, I learn something new, I meet new people, and then aside from attending conference, of course some conferences are free and you can just walk into.
Mhm.
But applying for them, I just feel happy when I do those
It
applications.
excites you.
Yeah, it's like I feel excited that
I know
I
that
obviously might
feeling.
not get yeah, I obviously might not get them, but when I'm applying, it feels like, oh, the last time I did this application, I didn't have this new thing to say. It feels like, oh yes, Yewande, you're growing. You've added this to your portfolio. Like just like having to introduce myself, having this conversation. It felt very nice and peaceful for me to say, oh, I just got another new offer to do
Yeah.
this. Yeah, I feel like it makes me happy that I'm putting myself out there. I'm getting something new for every new application. Maybe not every new, but randomly new applications. I have something extra to add on. And I
Mhm.
just have that piece that, yeah, okay, I might not get this, but with this, I can evaluate myself to say this was better than the last thing I applied
Yeah.
for. So, yeah.
Awesome, awesome, awesome. Yolanda, thank you so, so much for this conversation. It has been enlightening and interesting. Thank you
Thank
so very much
you.
for doing this. I appreciate it.
Thank you, Dale. And also, obviously, thank you for what you do as well, because I feel like young nurses, even experienced nurses can just go to your page and learn from other people. Like there's so many things to learn. You just realize sometimes that you're not alone. It's
Hmm.
not about the country you are. Maybe sometimes the countries affect, but with nursing, there's just that generalization.
Yeah,
And hopefully we get the cultural shift to enhancing what nurses are, what nurses look like,
yes,
what nurses should be, not just what people assume that we are. So thank
exactly,
you for what you
exactly.
do as well.
My pleasure, my pleasure. Thank you and thank you so much for being a part of it because you know what, I couldn't do this by myself. So all of
Yeah,
those who have so graciously taken time to speak to me on this, I really truly appreciate it. Thank you.
thank you.